So we're going to be looking at Learning Outcome 2 today for effective communication in health and social care. Learning Outcome 2 is be able to use communication systems and practices in the workplace. So there's actually 4 assessment criteria here. 2.1 is evaluate communication systems and practices utilized in the setting. 2.2, propose improvements to communication systems and practices. 2.3, explain the impact of poor communication. And 2.4, use communication techniques to support effective practice. And again, everything that we're covering will be based off the indicative content, which we've got just here. So it'll just be what I'm highlighting now, plus more. So this is the loose basis of it.
Yeah.
I'll just put this onto slideshow. So 2.1, evaluate communication systems and practices utilized in the setting. So the aim of communicating within your setting or within an organization is just to actually make sure that you're passing on information effectively. So you need to make sure that if there's a particular patient or a particular task that needs to be done, some things need to be done for them, you're using the right tools and techniques to actually pass on that information. So if it's simple information, obviously you'll just probably talk to them and say, right, I want you to go and change the sheets here, or I want you to look at the dressings for this person or give them this medication. But if it's very complex, if it's a lot of information, you'll probably end up having it written down and pass it on in that form. So in regards to that, there's 2 forms of communication. So you have formal and informal communication. So we looked a little bit about this, I think, yesterday. So we've got formal, and there's different types of formal communication. So written will be letters, emails. So you might have information on notice boards, you might have bulletins, you might have handouts, you might have patient records, like individual plans that you've got for each person as well. So those are some of the formal ones. Then you've got verbal communication, and this again is in the formal context. So you've got meetings, presentations, you might have a conference, you might have speeches, or it might be formal in the way where you as a manager or somebody else as a manager will be setting or delegating or telling you how to, your colleagues, how to complete a task. So they'll be passing on information and saying, right, you're doing this, you're doing that, and you're doing that. So they're sharing the tasks out between everybody. And then we've got informal. So informal can actually be quite productive, but it can also be unproductive. But we'll get into that in a moment. When you look at informal, so this can take place when you're having your dinner. You might be walking through the hallway and you might say hi to someone, or you might not have worked with someone for a while and say, oh, I'm not seeing you, that type of conversation. It could take place in the informal settings, like staff room, You probably end up doing a lot of chatting and gossiping in informal conversation. Like I was saying, it can be productive or unproductive. So it's got to be productive, it's got the potential to build teams. So you're building relationships with each other as you're talking to each other. And this is not just with you and other people that you might be in a work relationship with, but it can also be with the patients that you're looking after as well, or anybody that you're conversing with. So it helps you to build a relationship with them, in developing a friendship. It'll help you to get new ideas. There might be somebody who's might have gone on a training session and you ask them a couple of things and they might tell you what they learned. So you've learned something new as well. So when you're in a relaxed environment, you do end up, taking in a lot more than you will when you're not relaxed. So that can be productive, but unproductive can lead to, say, if you're gossiping or chatting, or, for example, you would say, Lee, you could say that, oh, I had a problem with Afsha today. She spoke to me really rudely. She looked down at me. She wasn't even paying any attention. and she kept on disregarding everything I said. I just didn't like what she was doing. And instead of coming to me and talking to me about it, you've talked to somebody else, and then they might go on and gossip. So it can be unproductive because there's like a gossip culture going on there. So instead of it being sorted out and saying, Asha, I didn't like the way you spoke to me, it gets passed on and on and on until I hear it from someone else. So in that type of way, it can be unproductive. So
yeah, I get that. You've got productive and you've got unproductive gossip. So productive gossip, you could probably say, oh, this person's doing really well, and
exactly.
I'm impressed with this person. But then it's like, oh yeah, that guy's an idiot.
Exactly. I mean, because it does, and then whichever work environment you're in, and I've taken part in a lot of gossip in my day as well. Just stood there and listened to somebody gossiping and saying, "Oh, really? Is that what happened?" That things do get passed on. It's normal. As adults, we do end up passing a lot of information on, and it can, instead of having a nice, relaxed work environment, it can create tensions and issues a lot. Yeah. So that was just quite and simple, just, communication settings, how we do them, how they take place. So when you're doing this, when you're answering 2.1, all you've got to talk about is formal and informal communication, how it's used within a workplace.
That's
so,
easy.
it is. It's quite simple, this one. You'll notice that the whole of this section is quite simple as we get onto it. When we get into 2.2 now, which is propose improvements to communication systems and practices, all you're telling me is how you can fix things. So how would you improve the communication in your work? So I've put some suggestions down here, and you're very welcome to use these same information as well, and just add a little bit extra information, make it more detailed. So some suggestions that I feel could happen are, you can have communication via email. So if you missed a meeting or you've not been able to physically go in and attend certain things, or you've been held back because you had some duties, so you can get that information that you've missed through email. You can stay in the loop with it. It's got something that you can refer to. Like even now when we'll send emails backwards and forwards, we can go and check on our email, can't we, and say, oh yeah, this is the time that we've got our meeting, or this is the information that Lee gave me, and so on. And I can check that anytime and not have to come to you and say, oh Lee, what were you saying the other day? So then it's something for you to refer to or look back at, as I was saying. What I find really useful is like group chats or group texts. Like when you can do that on WhatsApp, where you can have all of your you can have group text for all of your colleagues. So and then you can all put an announcement on it, or if it's somebody's birthday and you're gathering money for it, you can say we want it by this day, or we're having has anybody seen where this book is? I can't find it. That type of stuff on it. Like even saying that we had a meeting today and this is what we're doing, A, B, and C, that's what we've decided to do today. Your notice boards, make sure that they're updated, because I've noticed a lot of notice boards that, whether in a GP or in a work setting, in a school, which I'm more familiar with, they're always out of date. There'll be information on it which is like 3 weeks old. And so just make sure that they're updated, that you've got your main policies and procedures put on them. So like health and safety, equality and diversity, just like a summary of them. And that if there's any competitions or, fun things that are happening, have that updated on there as well. Yeah. And then just a couple more suggestions. Like have frequent meetings for staff. So have a weekly staff meeting, when everybody can come and attend. If they can't attend, make sure there's minutes of the meetings. So minutes of the meetings, it's just like a document where it'll say that Lee proposed these changes, Afsha said this, David said this, Rebecca said this. What happened exactly in the meeting. You can have a suggestion box, so this can be both for the employees and also the service users, so all the patients, the clients, anybody that comes in. They can put sort of suggestions in. They can put, you know, any ideas that they've got in. Maybe they can say, oh, we'd like a fish Friday or a soup day, you know, for lunch or something. And then again, same sort of system, have a complaint box. So if there's something that's bothering you as an employee or bothering somebody who comes in to use the services, they can complain anonymously, you know, if they're worried about repercussions as well. So again,
I was going to say, would I be able to add my own thing to this as well, like say like staff training?
Yes, definitely, because this is just an idea, some things that I put in, but yes, staff training is a fantastic one actually. So yeah, because obviously if you're doing staff training, you're all getting trained on how to communicate with people together, so you're all following the same process, aren't you? So yeah, that is a good one. So that was just 2.2. Like I said, it's quite a nice, simple one, this one.
Yeah, it looks quite easy.
Because when you see them set out, sometimes it can be like, oh, that's just a bit much. But when they're broken down, they're not as bad as they seem. 2.3 is explain the impact of poor communication. So how can poor communication actually affect your setting? So when you've got poor communication, it's going to limit your ability to have your optimal performance. You're not going to be at your best. It might have negative effects. You know, you might get sort of issues where a culture of distrust is created within the workplace. People are not talking to each other. You've got uncertainty. You're not having good interaction with your service users. It's just when you're not sure where you stand at, where you're meant to be, or if you're going into work and you're nervous about certain things, or you know that I'm going in, I'm barely going to get any information. I don't know what I'm doing today. You're not going to be able to work at your best, are you? So poor communication can affect you, your work, the organization, and also the people that come in to use the service in a bad way.
I can kind of understand with that because being in the setting that I'm in, you know, you get people that come. So it's a rehabilitation centre that I'm in, and you get people that come for different motives. So people come because they might want to get well, they want their family back, they want to get off from court, you know, the homeless or whatever it is. There's different motives, but sometimes, you know, if you say something, like I'm very upfront, me. So if someone, you know, does something, I don't beat about the bush. I'll say it.
You'll say what the issue is. Yeah, that's good.
Yeah, but sometimes I think I have to remember to keep my mouth shut as well, because when I do say these, for some things are just best kept not, you know, quiet, because it can stress the scene.
It can, yeah, I know exactly. I mean, sometimes it's good to just address the issue straight on, but then there's some things you've got to think about. Do I need to say this in a different way, or can I be blunt and can I just say, you know, you're being annoying right now? Because some patients or some people that come in, they probably do need someone to be, you know, straight on and say, you know, cut it out, don't do any crap, and just get on with it. You're here to get better, and I'm here to help you. Other people, you've got to mollycoddle a little bit more and be a bit more sweeter and a bit more nicer with them, and, you know, just work at their pace. So I think it just depends on you understanding the person that you're talking to, and, you know, seeing.
I get that, because like we're all different, aren't we? So what might be big to somebody else might be small to some, you know, to a different person.
Exactly.
We all react and respond differently to different situations.
I worked in a lot of primary settings for a very long time. So with little children ages 5 and 6, and my habit to be with those little children is be quite sweet and listen to them and get down on their level, and in most cases that works. But then I had a colleague that worked with me, and she was very factual and said, "Oh, stop crying, stop your nonsense, sit down and do your work." And with a lot of children, that actually works. Yeah. So sometimes it is nice to just be blunt in a respectful way.
Yeah.
So when we get on to here, we're looking at the effects of poor communication, and these can actually have serious consequences. So if you think about the setting that you're in, the rehabilitation center that you're working at, or you're in at the moment, within that, it's still a business. They still want, money and profit. They still want to be able to be successful. So it's still a business, isn't it? So
It's
when
not
you
about
look,
the money though.
yeah, it isn't. But then it's about what they can actually afford, isn't it? So if they're coming in, they're
Yeah.
getting patients that are using their system, or they're getting referred to regularly. They're going to get more income from the government, and they're going to be able to afford more equipment or more services or more staff. So it isn't about the money, but in that way, it's about what resources they can actually offer to their patients and to their staff.
Yeah, in order for them to,
Yeah.
I get that. In
Keep
order for
going, yeah.
people to get well, keep going.
So if you've got poor communication, it'll get rid of those profits. It'll probably end up, having, they'll say that, oh, this center isn't a good one. We really shouldn't refer our patients to here. Let's refer them to someone else. Because obviously there's some that have good reputations, some that don't have good reputations. Everybody wants to go into the ones that are known as being successful and having a good output. So when you're not communicating with with the people that are using the service, or with the people that you work with, it's going to have a negative effect. You can end up in having a misdiagnosis or do medical mistakes, so which might lead to health complications. So communication isn't just in how you're speaking to someone, but if you're there and you've given a dosage of medicine, or you've taken someone out for a bit of exercise already, or you've had a therapy session with them, you want to make sure that it's noted down on their patient notes, on their patient record, because you don't want somebody else coming and saying, oh, you've not had your therapy session today, let's go do that right now. Because you're wasting time, you're wasting money, and, that's miscommunication in there.
Yeah.
Then we've got communication failures. And these normally happen during a shift change. They're the most likely to happen at that time. So when a patient is being handed to another caregiver. So again, like we said just earlier, having inaccurate or incomplete information on their records, or ambiguous, as in you can say meds given 3 p.m. But what medication did you give? Which tablets did you give? The patient might be on 2 or 3 different types of medication. So you're not given the full information there. So what will happen is you're starting to do guesswork, you're trying to figure out, and you're asking the patient, oh, which pill did you have? The little white one or the yellow one, or was it the green one? And then it just seems like you're not very professional either. So it can have a lot of negative effects. So like it leads on to, it can be the patient's receiving the wrong treatments or the wrong procedures, they're getting given incorrect medication, and results are delayed, tests are delayed, the treatment isn't given at the right time. So all of these are the impact of poor communication. So that was just like a basis in general. Now we're looking at the effects of poor communication between clinicians and patients. So any caregiver, so doctor, social worker, volunteer, nurse, it doesn't matter who it is, they're all clinicians. So when you have effective communication between clinicians and patients, it's essential that you're actually getting the proper information, that you're actually speaking to each other properly, you're listening, you're paying attention. So clinicians need to listen carefully to what the patients tell them. So they need to look at listen to them verbally, but also look at their non-verbal cues. Are they gathering their body language up? Are they withholding information? Do they look a bit shifty? Like, they don't look like they're telling me the truth right now. You can tell a lot by just looking at the patient. So you need to be able to get the information, reassure them, your patients, and communicate any important medical advice. A lot of patients don't actually have a lot of knowledge about medical matters. They just know that they've got to do if they've been in close contact with somebody who has diabetes, they might know a little bit about how to check your blood sugar levels, or they might know how to, what sort of medication names they are. But a lot of them won't know that type of information. So you've got to make sure that you give them information on a level that they actually understand it. So if they look confused and you're using like terminology of certain medicines, or you can actually just explain this is a pill for this or that, and so on. When you do have poor communication between the clinicians and the patients, it can result in misunderstandings. You get miscommunication. You might end up doing the wrong instructions. You might end up getting wrong medication. So, you're going to have poor outcomes. You might get readmissions, so someone's gone home and they've been sent back. There was a case which I knew of a while ago, and I only found out about this because of a reason I'll let you know. What happened with a school child is that he went in complaining of abdominal pains. And from what was explained to me, I could tell it was an appendix issue. He went into the hospital, they checked him, and they sent him back home saying, oh, no, it's just a bit of a stomachache. It's fine. It's okay. Then he went home, was there in a lot of pain. A few hours later, his appendix actually burst, and he had to go into hospital because for 6 weeks, and he had because of sepsis. So that was an issue, that he was misdiagnosed. He wasn't given the right attention. There wasn't a good follow-up on care. Now, the only reason I found out about this was because my eldest, he had abdominal pains, and it turned out that was appendix. But I took him in. I spoke. He was fine. He got all of his things done, sorted out for him a few weeks ago. When I spoke to some of my colleagues, some of my older colleagues that I used to work with, they told me the story of a young boy that was in year 6 at that time. And it shows you what happens when you get good communication and what you get when you have bad communication, when people aren't talking to each other or if people are too busy. So that child, instead of having an overnight stay in hospital to get his appendix done and being home the next day, had to stay there for 6 weeks, which resulted in a lot of issues, legal problems, missing school, and so on. So it can have big effects.
It's mad, isn't it, these doctors? Because obviously being in a rehab and stuff as well, with the coronavirus, especially when everything was in lockdown, you get a lot of the lads that come here and they'd be coming off the street and they'd have issues. They'd have like trouble with the teeth, or trouble with the health, or whatever it was, or the mental health even. And they'd ring the doctor, and the doctor would be like diagnosing them over the phone.
Over the phone, it's ridiculous, isn't it?
It's like, how can you diagnose someone over the phone?
No. And then they ask for pictures to be sent or over an app or something, and even that, it doesn't work. Because I know when I was with my son's 14 now, so this is only happened about a month and a half ago. When I actually phoned up and I said that he's not well, they kept on telling me that, he must have had a bad stomach, it might be diarrhea, give him this medication, do that. And then when I was touching his stomach, he couldn't even stand a slight touch. And they were like, oh, no, don't take him into hospital. It's not a safe time to go. But I had to really push and be quite nasty in some ways. I don't like saying it in that way, but quite forceful to say, no, I'm actually going to be bringing him in. And it was a good thing that I did, actually. But I understand exactly what you mean. It's like that, that culture has been adapted now where, oh, you're okay, you're fine. We'll just tell you what you need to do. And it's not even the proper care that's being given at the moment, to be honest.
Because I think about this quite often. And I think, like doctors and stuff like that, they're basing their information on a textbook based on someone else's opinion.
Yeah.
I mean, it's not.
It doesn't.
I don't think.
I mean, you can't beat face-to-face communication, though, can you? I mean, this is essential when it comes to care. Because obviously, with you being in the centre now, you know that when you physically see someone and you're seeing, oh, look how bad this person's teeth have gotten. And then when they've called and they've not been allowed to come in, or they've just been told, oh, you'll be okay, and this and the other. And then you realise what the effect it's having. Yeah.
Yeah, it can be quite bad. Quite bad for some of the lads. I was on medication when I was on a lot of medication when I first come. I don't take anything now. But I don't believe in medication. But that's me. I don't believe that there's not one medication out there that can heal anyone. They can help with symptoms.
I think it's more about your. I mean, I'm not sure exactly where I stand in that. I think there are some medication that will help. I'm not happy to take a lot of medications. I mean, I'm quite bad at taking paracetamol and things like that as well. I always think if I just sit down quietly, headaches and things will go away. But obviously, there are things that are there that will manage your iron levels or will manage your blood sugar and so on, and they help you. But again, it's lifestyle changes that will help even more.
What I mean is there's no medication out there that can heal somebody.
Yeah,
there's nothing that can, because if you've got, say you've got acid reflux and you get omeprazole, you get the omeprazole, the acid reflux goes away, but it doesn't mean it's not going to come back next week.
Exactly.
You know what I mean? There's nothing out there, no tablet, nothing that can heal anyone.
So it just looks after the symptoms for a little while, and then I know exactly what you mean. Yeah. We're going to come on to the effects of poor communication between physicians and nurses, so doctors and nurses now. So the most common communication failures happen between clinicians and nurses is about miscommunication of important information. So when you're not getting given the correct patient symptoms, or you're not being told about their condition, or the documentation isn't being put down properly. So these issues can lead to incorrect decisions about treatments being made and delays to treatment. So communication problems can happen for a lot of reasons. So you might have ineffective policies and procedures, you might have language difficulties, poor communication skills. So if a person who's looking after the patient doesn't really understand them, they had a language barrier or a dialect barrier or an accent barrier, that might have happened in the wrong information being given. Sometimes you just don't have the time. I mean, you probably already know how run off your feet you cannot get trying to look after one person and the other, then the other. You don't. Sometimes you don't actually get much opportunity to just even sit down for 5 minutes because you're running around. So that can be an issue as well. Then you've got poor documentation and even conflict between staff members. So if there's two people that don't like talking to each other and they've been put onto the same service, that might have a bad effect also. So that was 2.3. So just a few things that might happen for poor communication and the impacts of it. Then we've got 2.4. So use communication techniques to support effective practice. So a couple of techniques that we can use here is to listen to feedback from your colleagues and also the people that are using the services. So actively listen to them. So actually make sure that you're paying attention to what you're hearing and you're understanding what they're saying. So you need to actually understand the words that are being spoken and actually know what they mean. Now, the best way to do this is that if somebody's telling you something and you're not 100% sure what they mean, ask questions, ask them to clarify. And the best way that I find to do this is I will say, so you mean, and then I'll repeat what I think they have said. Or I'll say what I understand it, and then I'll repeat what I think they have said. And then they can say, oh yeah, that's exactly what I mean. I'll then be like, no, that's not what I mean this. And then you can ask them to explain. So you get another chance to actually understand what they're trying to say to you. Make sure you note down the information. So note it down as close to the time as possible that it's been done. So if you've done a treatment, if you've taken someone for a therapy session, if you've given someone their pills or changed bandaging, put down on their records exactly what you did, when you did it. Don't delay it for 5 minutes. As you've done it, write it down. Takes a couple of seconds. And then also use the Sola model to pay attention to the patients. Now I'll show you what I mean with the Sola model. Now the Sola model is just it's a technique that you physically do to show someone you're paying attention to them and to actually give them 100% attention. So Sola actually stands for sit, open, lean, eye contact, and relax. So it's just the first letter of each one. So for sit, face the patient squarely. So sit down in front of them. Don't cross your legs. Don't cross your arms. Sit in a nice, have a good posture, no slouching, and just face them so they know that you're, paying attention. Have an open and friendly body language or friendly posture. Don't cross your arms. Don't squint at them. Don't, show them that you're bored. Be as non-threatening and open as you can be. In other words, try to be as relaxed as possible without falling down and falling asleep into your chair. Then lean towards your patient. So actually be with the patient, so they know that you've got their 100% attention. So while you're talking to them, don't be writing notes down. Don't be looking at your clock. Don't be looking at anything else that needs to be doing. Just lean towards them slightly. This will help you to encourage the communication to get them to start talking. Have eye contact, but make it regular. Like we were saying yesterday, make sure we're not staring someone down. Sometimes eye contact can mean attraction. Sometimes eye contact can mean aggressiveness. So you've got to it's hard to explain. You would probably end up understanding it as you're doing it. So have eye contact, look away, look again. So as long as you're not constantly staring at them in the eyes. And then relax. So make sure you know what your own body language is like. Make sure you're not, offending someone or, doing certain gestures which might mean something in a different culture. And, so it's just try and relax and sit there calmly listening to what the person is trying to say to you. So all of these points.
So, now go on, it's okay. I feel like I keep interrupting. I feel
you can interrupt as many times as you want. I like it when you do because it's nice having your input as well. So please, do.
There's a lad in here called Matthew, and he's got a few disabilities.
Mm-hmm.
He's nearly finished the program now, but he struggles getting in the shower and stuff.
Yeah.
Cleaning his room, getting in the shower, and you have to prompt him. But there's like a few lads in there, and they'll be like, Matthew, get in the shower, and so I'm looking at them thinking, well, why are you talking to him like that?
Yeah.
You know what I mean? And I'll pull him to the side. I'll say, Matthew, do you want to get in the shower and try and get it nice, because I'll jump in straight after you when you come out. You know what I mean? And then it's not what you say, it's how you say it.
Yeah, you're encouraging.
Yeah.
You're 100% right in that factor. Some people think that some people think that someone's just being lazy, that they just can't be bothered, and that if you be too nice to them, they're just not going to listen to you. So we've got to say, right, get on with it right now, do this, do that. But it doesn't work. You've got to give somebody incentives. You've got to give somebody a reason. So like you're saying, if you go in the shower now, then I can go in after you. So come on, let's get that sorted. That's a really good way to go. There was a good example of what you just said. Is there was a little child who had he didn't have any learning disabilities or anything, but he didn't get very much support at home, and he got distracted very, very easily. Now, I worked with this child for a year, and then I ended up going back into his class the following year. So he was in year 1, and then I went back just for a couple of days into his class in year 2. When I went there, and the person that was meant to be looking after him, she was like, "Oh, come on, you're so lazy, you do this, you've got to get this done right now." And then there's other children that are enjoying like art activities and, being able to walk around the classroom with pen, paper. So he's quite distracted, and he's not doing his work. He's just staring at them. And at that time, I thought this isn't the right way for you to speak into him. You need to sit down next to him. You need to encourage him, maybe write things on a whiteboard so he can copy it off you. And so in the end, I ended up taking over, and I did take him out of the room, and we got the work done that I needed to do in 10 minutes, rather than him sitting there staring at the other kids, feeling left out. So what you're doing with that lad is fantastic, where you're giving him a different type of incentive. You're sort of saying, oh, come on, you go first and then I'll go after you. You're encouraging him, so he knows that, oh, I better go now because Lee wants to go next. So it really does help when you're sort of being a bit more considerate with them.
He kind of listens to me,
Yeah.
He has like smelly trainers. No one will ever say that to him, though. Well, not in front of me anyway.
Mm-hmm.
And to try and get him to, he's got brand new trainers, but for some reason he just likes putting his old clothes on that have got holes and stuff in. But I got him the other day, and I said, Matthew, go and get changed upstairs, put your new trainers stuff, and we'll take a picture and we'll put it on the website.
Yeah.
For reach. And the staff want to see you in your new gear, in the office. And it was as soon as I mentioned staff, it's like, oh, I need to show off in front of the staff. He got dead excited, and he ran upstairs and got changed. So again, it's how you say it. It's not what you say; it's how you say it.
And I think the fact that when he's wearing his older clothes, he's got a sense of comfort in them. It's what happens is, especially when people have some type of learning disabilities or any sort of issues, to say it the nicest way, any sort of like sensory difficulties, they like comfort. They like to be able to have a familiarity. So even though his clothes are all ripped up and maybe not in the best condition, it's how he's comfortable. He feels like he's in his own skin. But when you're encouraging him in that type of way, because you can tell he wants to be noticed, he wants to have somebody saying well done to him. So I think you're doing a fantastic job, Lee. Really well done.
No, thank you. Appreciate that. Thank you.
You're very welcome. Seriously, it's because you need people that can actually be empathetic with others. So you can empathize with him, and you can actually encourage him to do a lot of things. It's not, with being in education for a lot of years, it's not easy to motivate people, and you've already got that relationship built with him. So develop that, keep going with that. You're really doing very well with him.
Thank you.
So that was it for this. It wasn't, like I said, it wasn't a very long one. It's quite nice and simple. Just use the information that we've got in here. It'll really help when you're doing assignment. So we just looked at formal and informal communication. We looked at some improvements that can be made, like you said, staff training, which is fantastic. We can do, suggestion boxes, meetings, and so on. Sorry, excuse me. We looked at what the impact of poor communication is, and then we looked at communication techniques that we can use to have effective practice. So, and that was it. I'm just going to turn the recording off.